Hi, I'm Dr. Bagen. I'm a primary care sports medicine physician at Florida Orthopaedic Institute, and today we're going to talk about carpal tunnel. So carpal tunnel is actually pretty common. It's the most common compressive neuropathy. In this case, it involves the median nerve, and for a lot of people who are working from home right now, doing a lot of typing and writing, that type of thing, you may be experiencing some of these symptoms. So we'll talk about those today. So with the carpal tunnel, there's a relatively small space that goes through your wrist, bordered by bony structures and a ligament as well. And you've got 9 different tendons that are running through that small space, plus the median nerve. So anytime you have inflammation or enlargement of any of those structures running through there, you can cause some compression on that nerve. And what people usually complain about is pain in the hand, but also numbness and tingling in the first 3.5 fingers. So your thumb, your index finger, middle finger, and then half of your ring finger. Once it gets to a certain point, if it progresses, you can actually have some weakness in the hand as well, and even some muscle atrophy in the hands as well. But that's usually kind of long term. The way we diagnose this, we don't necessarily need to do x-rays or an MRI, any sort of advanced imaging. We can usually just diagnose it on physical exam. There's a few maneuvers we can do to help us to elicit your symptoms and get that diagnosis. Sometimes we do need to do an EMG or a nerve conduction study, but that's not always the case. So treatment for carpal tunnel. Conservatively treating it, we like to do NSAIDs, so anti-inflammatory medications. We can also do night splints, so some people experience more pain at night, and we're able to help with that nighttime pain by putting the hands or the wrist in a brace at night, and that can help with some of the symptoms. And one of the other things that seems to really help with carpal tunnel is a steroid injection to help decrease some of the inflammation that's going on in that area. A lot of times that steroid injection is a good predictor of whether or not a patient will do well with surgery. So there's also the option of a carpal tunnel release surgery to help with those symptoms as well. So we usually try to treat everything conservatively, and if it doesn't seem to help, or if you do get some relief with the steroid injection, which would be a good predictor of success with the surgery, then that would be the next option. So yeah, if you've got any sort of symptoms like this, you want to treat it conservatively, or you have any questions about carpal tunnel, then just let us know. Thank you.